Hi guys, welcome back to the 38X Follow Along Mobility Series. It's Paula here, one of your coaches. I'm going to take you through some mobility and stretches today for your shoulder complex, because we know that we get a lot of neck and shoulder pain. It's probably one of the most common things apart from lower back, but it's connected. So because we sit in triple flexion, so most of us sit in this, we have forward head posture and we're leaning over our desk. We're very short in the front line. So in one of the mobility series, I've done just hip flexors, so make sure you get onto that and follow along on that one, because that is really important to do, so we can then start to build on this chest opening and stretch and shoulders. Yeah. All right, so to start with today, we're going to take the right hand, so follow along, take your right arm and place it behind your lower back, and then take the left hand and place it on palm to palm. And then that means you've got this tucked in, so you've got your upper arm bone tucked into your torso, and then I want you to take your left ear down to the shoulder and then bring it back. Breathe in and breathe out. So we're just going to do this really nice and gentle mobility. It's very gentle down a lot of those neck flexors. And this one here is that sternocleidomastoid, the really big one that you can feel sometimes see protruding when you've got a lot of tension in the neck. Yeah. So you've got this mobility, and then let's switch sides. So now we're going to take the left hand behind your back, take the the left hand onto the right, palm to palm, and then take your breathing from your head to ear to shoulder from here, back to center, and then down, and then back to center. Beautiful. One more. Down we go, and then back in. All right, one more from there, and you should feel that in the side of the neck. All right. Now, because we've just done some mobility around those neck flexors and sternocleidomastoid, we're going to take our hands and do some hand therapy. So you're going to take your left hand and you're going to draw it to just under your earlobes here, and we're going to draw it, we're going to drag the skin. So I'm going to turn my head, you're going to drag it down to just above the clavicle, yeah? So you're going to take it, drag it down, press it in, and drag the skin down. That's it. Now I'm going to face front so you can see what I'm doing. I'm going to drag the skin, but I'm also going to move my head from side to side. See that? So I'm just stretching and mobilizing. Yes? All right, let's do that on the other side. So I won't turn to side. I'm going to drag the skin down, right down to the clavicle, and then do it again. So you're going to breathe in and out, all the way down, all the way, and then you're going to turn the head from left to right now. So dig it in, pin the fascia, and then start to move your head from left to right. Don't need to tell you where you're going to feel that, because it's right down the neck where you get really tight. And then do that maybe one more time. All right, beautiful. Now, because that comes into the chest, let's take the fingers behind the back, lift up nice and tall. Now, as you can see, I've got my hips lifted, so this makes it easier for me to elevate. So if you're not lifted in this position so far, maybe get something like a pillow or a block or something to elevate, or a towel, and sit up a little bit on your pelvis, so it's easy to maintain long spine. And then interlock the fingers behind the back, and then lift up the head first. So lift the head so your spine is nice and tall, and then lift the arms. Don't lift the arms before you draw the head back. Otherwise, you're going to draw your chin forward. All right, so you want to draw your head back, so sit your head right on top of your spine, and then release. Now, what I'm going to do is I'm going to do that mobility. I'm going to drag across so we came down from sternocleidomastoid down to the clavicles. Now, I'm going to take my fingers, pin the skin right in that corner, and then I'm going to drag the skin right along, and I'm just going to move my head from left to right. I'm going to just unload right to the center of my sternum, right here. So keep dragging the skin, and we're going to do that one more time. So dig in, so like right in, not just stroking it, it's not a massage, in, And then from here, drag the skin, right, draw the skin across and then turn your head from left to right. Here we go, just turn the head from left to right, drag it in, all the way through to the center, almost there, beautiful. All right, and then let's do the other side. So drag it in, so dig in, and then turn your head left to right, use your breath, and you're gonna feel that one side is tighter than the other. All the way in, and out, amazing, perfect, perfect. And then let's do the other side. Remember, we're just dragging that skin right from across underneath the clavicle to that collarbone, and you're really getting that, releasing all the fascia around the chest and the shoulders. Here we go, all the way. It's a good one. All right, awesome. And then from here, take the arm up, and you can either take the arm, the other arm, and pull back on the tricep so you feel that stretch down the back of the deltoids. Or if you know that you have that mobility, you can interlock the fingers. You can use a towel if you want to do this one, but I've still got my head back in space, yes? So I'm going to hold this position, take a deep breath in and out. So you're releasing the tension through those muscle fibers and connective tissue. Take a deep breath in and out. Release the fingers. Take the other arm up. Remember, you can use your towel. You don't have to take the towel or hand behind your back. You can just take this stretch, or you can take the bind. You decide. Take a deep breath in and out. You can feel that tension loosen around those muscle fibers and connective tissue. Take another deep breath in, keep that head back, and exhale. All right, then from here, I'm going to straddle my my bolster or your pillow, and you can take the hands under the back of the knees, and you're going to round through your upper back. Hold that stretch. That's it. Perfect. Keep your chin on your chest. Take another deep breath into the back of the lungs and the ribs. So now you're feeling this between the scapulars in the upper back. In those posterior deltoids. We hold a lot of our tension here. And then come up. And I want you to extend and lift. So I want you to extend the spine, and then draw the shoulders back, and then come into that stretch and release that tightness. Now we're going to cross the arms over. Okay, take the arms over and come into that stretch. So you've got one arm over the top. Take another deep breath in, and then take the arm that's underneath, place it on top, so it has a slightly different stretch on one side than the other side. Take that stretch. Deep breath in, and then up, lift up, hold on to the front of the knees, lift up, and then tilt back. Take a deep breath in, and out. All right, guys, thank you for joining me today to unload all around that head, neck, and shoulders and soft tissue stuff. Until next time, see you then.